Good evening. We're so excited to have you as part of the Winkler Athletics family. First, my name is Amy Leslie. I'm the head athletic trainer here at Winkler Middle School, not to be confused with a personal trainer. You can see the little blurb there about what an athletic trainer is. First, a little background about me. I have a Bachelor's of Science in Athletic Training from Greensboro College. Then I went to Columbus State University in Georgia, got my Master's of Education in Health and PE. I did pass my Board of Certification exam, the BOC, to be nationally certified as an athletic trainer, and I'm also licensed in the state of North Carolina to practice as an athletic trainer. Why we need an athletic trainer. I love to start with this quote from a fellow athletic trainer who said, "Would you drop your child off at a pool that didn't have a lifeguard?" If the answer is no, then you shouldn't drop your child off at a sporting event without an athletic trainer. First and foremost, I'm here for the health and safety of every student athlete. All sports, carry an inherent risk of injury, and obviously I'm here to take care of those injuries should they occur. I'm also here to obviously evaluate injuries, treat injuries, rehab athletes after injury, but my main goal is to hopefully prevent injuries in the first place. And also, I take care of all the paperwork and documentation. When am I here? I'm required by law to be at all football practices and games and now wrestling matches. For all other sports, I'll always be at the home games. I'm also available before and after school each day for meetings, if anyone were to get injured if I wasn't here at a practice. All middle schools we play have an athletic trainer or first responder, so when teams travel, they will still have medical coverage. What I need from parents, the biggest thing is communication. Anytime there's an injury, if I can't get in touch with you on the phone or speak with you directly after practice or after the game, I'll always send home a parent injury letter with my contact information so that you can get in touch with me if you have any questions. If at any time your emergency contact numbers change, if you get a new cell phone, a new number, or anything like that, please let me know so that we can update that emergency contact information for the coaches. Please know the date of your child's physical and when they need to renew. Physicals performed on or after May 3rd, 2016 now last for 395 days. I know people have been asking for that for years, and we finally got the rule passed. So it's good for a month, after the rule used to be 365. All paperwork from physicians' visits need to be given to me. Copies are fine. You can keep the original, but I need to know what the doctor says so that we are following the correct protocol. So first education portion tonight is nutrition and hydration. Please take a nutrition handout. Just one handout per family is enough. I recommend taking it home, put it on the refrigerator, or even maybe the student athlete keep it and hang it up in their locker, somewhere where they're going to see it and be reminded of it. One of the most frequent injuries I hear about from our student athletes is my stomach hurts. Students are not eating a good, nutritious breakfast, nor are they eating a healthy lunch. Nutrition is very important for athletes. It's the source of energy that gets them through the day and then gets them through their practice. The food we eat impacts our strength, our training, our performance, and our recovery. Staying hydrated. It is key that all student athletes stay hydrated, especially those that play outside in the heat and humidity. Dehydration is one of those things that even a small amount starts to affect your level of play. Student athletes should be drinking water and or sports drinks to stay hydrated. Okay, please avoid sodas and energy drinks. You can see annually there's 13,000 emergency room trips due to the side effects of energy drinks, mainly people feeling like they're having a heart attack. Student athletes taking stimulants such as ADHD medications have been shown to have some problems with thermoregulation, meaning keeping their body at that 98.6. So they really need to focus on staying hydrated. So you can see the examples of the medications there that I'm talking about. Little pop quiz question. How can you check if you're hydrated enough? Let you think for a second. Hint, you do it 3 to 5 times a day. Obviously, it is Your pee. Athletes have probably noticed that in the locker room, this exact pee chart is hanging above the toilets and the urinals because, I know it sounds gross, but you should be looking at your urine, okay, to make sure that you're hydrated. You're looking for the colors there for 1, 2, and 3. Anything below that, 4, 5, 6, 7, 8, obviously you're dehydrated. If we're getting down to 8, it might even be an emergency room trip. That's bad. Next education portion is on asthma. Allergies. Your child's coach will be made aware of any allergies or concerns with asthma that was marked on the pre-participation physical. If you feel like you maybe forgot to mark something, please, let the coach know, let me know, we'll update that. If your child has an inhaler or EpiPen, I suggest you give one to myself to put in the team's medical kit for practices and games. I know those things are not free. They can be very expensive, even with insurance. So if that's not possible, that's fine. It's certainly not a requirement. It's just a recommendation. Also, what the nurse has on file is not accessible after school. Those things are locked up in her office and we cannot get to them. Next education portion, sickle cell anemia, just something I like to educate the public on. And we have had student athletes here that have anemia or have sickle cell. So red blood cells are supposed to be disc-shaped, almost look like a donut, but the hole is still there. Sickle-shaped means that the red blood cells are shaped kind of like a crescent. Sickle cells are stiff and sticky. Obviously, that can lead to blocked blood flow in the blood vessels. People with sickle cell trait usually do not have any symptoms of sickle cell disease. However, especially in the hot weather and if they're dehydrated, sickle cell trait patients may experience the same complications as sickle cell disease. So some facts about sickle cell trait. It affects 1 in 12 blacks or African Americans in the United States. Sickle cell trait is also prevalent in Hispanics. Approximately 3 million people living in the United States have sickle cell trait, and many are unaware of their status. A simple blood test can be done in the doctor's office. And ever since, I believe it was 1995, all newborns were screened in the United States. So obviously all of our children here, should have been screened as if they were born in the United States. But you, as a parent, may not know, if you have sickle cell trait. So if you're curious, like I said, simple blood test in the doctor's office. In the past 7 years alone, sickling, which is when sickle cell trait patients exhibit those same symptoms as someone with the disease, it has killed 9 athletes in this country. 5 were college football players, 2 were high school athletes, and 2 were 12-year-old boys training for football. So it's not a huge problem, but it certainly is a problem. We want to make sure we're taking care of our athletes to the best of our ability. Another pop quiz question. Does anyone know who the former, he no longer plays with them, the former Steelers safety who has sickle cell trait, and then what city he could not play in? In case you didn't know, I am a big Steelers fan. The answer is Ryan Clark. He was a safety for the Steelers, and he couldn't play in Denver because of the altitude. It messed up his sickle cell trait. So athletes with sickle cell trait, obviously they can participate in every sport. There's no problem there. Biggest thing is making sure they are staying hydrated, especially if they play in the outdoors and it's hot and humid. We got to keep them hydrated. Obviously, they kind of have to set their own pace as we're starting at the beginning of the season. Rest often. We don't want to overwork them. Drink plenty of water before, during, and after. Keep the body temperature cool when exercising in the hot and humid temperatures. And then obviously, if you're feeling ill, let someone know. Don't feel like you're being weak or that you're not a strong athlete or anything like that. Please let us know. We want to take care of you. Next education portion is on MRSA. MRSA stands for methicillin-resistant Staphylococcus aureus. Obviously, we like to call it MRSA for short. It's a staph infection that does not get better with the first line of antibiotics that we have available here in the United States. Most MRSA cases are spread through skin-to-skin contact. Once the staph germ enters the body, it can spread pretty much anywhere. Obviously, heart and brain, once we get to that point, we're looking at it being fatal. Recent CDC reports found over 80,000 severe MRSA infections and 11,000 deaths per year from MRSA. Signs and symptoms of MRSA. A staph skin infection usually will be red, swollen, painful area on the skin. A lot of people say it looks like a boil, maybe a big pimple. There is pus or other fluid sometimes that will drain from that area. These symptoms are more likely to occur where the skin has been opened in some way, cut, rubbed with a blister or something, because that's how the germ gets into the body. Symptoms are also very likely near hair follicles. I had a football player when I worked down in Georgia who had a terrible staph infection. It was not MRSA, but staph infection under his arm, in his armpit, because that's obviously a spot where the germ can get in. So some pictures for you tonight of what MRSA looks like. You can see the bottom picture there. I commonly get the spider bite. Oh, it's just a spider bite. No big deal. It is a big deal. You need to get it checked out, get it seen by someone, all those good things. All right, so treatment of MRSA. Draining of the skin infection may be the only treatment that's really needed if it has not spread. Obviously, this needs to be done by a physician. Please do not do this at home. Keep any sore or wound covered with a clean bandage. Severe MRSA infections, obviously, like I said, are becoming harder and harder to treat, so it's important to be diligent in preventing them in the first place. So, pop quiz. What is the best way to treat MRSA? It's kind of a trick question. The best treatment is prevention, okay? Preventing it from ever happening in the first place. The best way to do that is wash your hands, okay? Wash your hands with warm water and soap throughout the day. Also, athletes, do not share personal items. Towels, razors, deodorant, clothing. I know some people are superstitious and they have those lucky socks that they have to wear every game, and they can't take them home and wash them because that takes the luck out of them. That's not healthy. Hey, that's not safe. That's how germs spread. Okay, so please make sure you're taking your clothes home, having them washed. And if somebody asks, hey, can I borrow your shirt from yesterday? No, too bad. Don't share your personal items. Obviously, wear clean clothes at practice each day. Take a shower every night when you get home from practice. Okay, and when I say shower, I don't mean stand in the water and twirl around. Okay, actually get some soap on a cloth, rub it on your body, scrub those germs off, and then rinse the soap off. All right, last and final, and probably most important education portion, concussions. In the state of North Carolina, June 16th, 2011, the Gefeller-Waller Concussion Awareness Act was signed into law. Sadly, the name of the law comes from two student athletes, their last names, who lost their lives because of mismanaged concussions. Obviously, we don't want any more laws named after kids that have died. So here's the parts of the law that we'll go over tonight. The main focus of the law is education. Obviously, that's what we're doing here. The other parts I'm responsible for, emergency action planning and post-concussion protocol implementation, and then clearance and return to play or practice following a concussion. Speaking of emergency action planning, if you take a look around any of our venues where we practice or play, you will see the Winkler Athletics Emergency Action Plan posted. There's a huge poster outside at the concession stand, which covers our outdoor sports out there. There's 3 different copies posted throughout the gym. There's one in the auxiliary gym. There's one in the cafeteria. Wrestling practices in the cafeteria sometimes. So everywhere where we play or practice, it is posted. The coaches are taught each year. We go over it. We practice things. So obviously it's a big part of this law, and it's a very important part. Some facts about concussions. A concussion is an injury of the brain, and it's associated with a temporary loss of brain function. They are invisible injuries, so it's not as obvious as, say, a sprained ankle or a broken arm, where we can see that the athlete is injured, and people, naturally want to help them. They feel bad for them, et cetera, et cetera. With the concussion, a lot of people don't see it. Some people don't believe them even, and it's a difficult injury to take care of because of that. I love the quote I got from a continuing education seminar I went to. They said concussions, sorry for the typo, are like snowflakes, meaning every single one is different. They are all unique. How they present themselves, how you treat them, it's always going to be a little different. Concussion is a functional abnormality, not a structural one, meaning that when you go to the ER or even the doctor's office, an MRI or a CT scan is not going to diagnose a concussion. Those tests are great for finding bleeding on the brain or problems like that, but you're not going to see a structural problem with the brain. 85% of concussions do not black out. That used to be an old wives' tale. Even when I was in school, that was the question or the coach would ask. Well, did you black out? No, that's not a concussion. We know now that's not the case. There's no significant relationship between mouth guards and concussion prevention. Now, mouth guards are very important for your teeth, especially student athletes that have braces. Other than that, there's no relationship between preventing concussions, from wearing your mouth guard. Another quote, obviously from a continuing education seminar I went to recently, said that it's everyone's job to protect the kids when it comes to concussions. All referees and umpires are trained on recognizing signs and symptoms of a concussion. All coaches are, obviously now all parents and athletes are, the athletic director is, I am, everybody that's around the student athletes is trained and there to help. A couple more facts. Recovery takes longer in the adolescent brain because it's still growing and developing. So you cannot compare yourself, athletes, you cannot compare yourself to college athletes or professional athletes. Oh, well, so-and-so got a concussion on Sunday at the game and he's already practicing this week. Yes, he might be. His brain is finished growing. It heals a lot faster. Cognitive rest is the most important part of recovery because it's a cognitive injury. Okay? It's that functional problem with the brain, so we have to rest it. Probable long-term effects of poor concussion management, permanent brain dysfunction, depression, dementia, poor decision-making. There's even possible links to Alzheimer's. There's been a lot of research, obviously through former NFL players, and you may have heard of CTE. It's basically the tau protein buildups on the brains that they're autopsying from these professional football players that have passed away, and it's scary, the damage that is happening to brains because we're not taking care of concussions properly. Signs of concussion. Okay, so these are what you're looking for in an athlete who's possibly concussed. Now, don't look at this as a checklist, meaning that they have to have all of these. That's not the case. Sometimes they might have 1, 2, 4, 5. Again, they're all snowflakes. They're all different. But sometimes they appear dazed, stunned, confused. They forget the plays. They're unsure of where they are, who they're playing. They move around kind of clumsily. They take a while to answer even simple questions. Sometimes they lose consciousness. They show behaviors or personality changes. I had a concussion a couple years ago where the kid came off the football field and you could tell something was wrong. And we sat down and I was asking him questions and he just burst into tears. I mean, bawling, and obviously that's a behavior or personality change there, and something to look out for. Sometimes they have a hard time remembering exactly what happened right before or right after the concussion happened. The flip side of that is concussions of a symptom. So this is what the athlete will complain of if they are hopefully being honest with us. They'll complain of that headache or pressure in their head, feeling like they're going to throw up, maybe even throwing up, feeling dizzy, complaining they're seeing double or blurry vision, sensitivity to light and noise, very similar to a migraine, feeling sluggish, everything's just moving too fast, they can't keep up, concentration and memory problems, and my favorite, just does not feel right. Okay, they know something's wrong, but they can't really put their finger on it. Another pop quiz question: what do you think is the most commonly reported symptom? It's a headache. And obviously we get headaches from all different things. So that's what makes it so difficult to diagnose concussions. And it's being updated and made better every day, every month, every year. We're getting better research on how to recognize concussions, how to diagnose them, and then obviously how to treat them. Speaking of concussion management, if an athlete is suspected of a concussion, they will be removed from play immediately. Okay, they will be evaluated to determine if they are concussed or not. Now there's a packet. It used to just be one page that we would fill out and send to the doctor. Now there's a whole packet with all kinds of information in there that will be filled out on the top portion on what happened so that the doctor knows. And then the rest of it will be filled out from the doctor to make that call as to whether they are ready for the return to play protocol. And another part of that actually is, and I'll talk about that in a minute, is the academic part of it. You know, obviously they are a student athlete. A student athlete with a concussion needs cognitive rest during the healing process. So that doesn't mean lock them in a dark room and leave them alone. That, again, that's an old wives' tale. We know now that's not the best way. We just need to limit the things that are stimulating their brain. So reading, watching TV, video games, working, playing on a computer, texting, and obviously looking at that small font on your screen, all that. Those types of things prolong healing. Many doctors, like I said, will fill in academic recommendations. There's a whole part in the packet that's called Return to Learn. And obviously myself or Nurse Trish will communicate those to the teachers so that they are aware of what's going on. So what I need from parents after a concussion, again, communication is key. I will be in contact with the student athlete's teacher to check in on their performance in class and obviously report back to you. The most important thing I'll need to know is if they are behaving in any way outside of what is normal for them. Obviously, you're with them more than I am, so you know what is normal versus not normal for them. During that process, email is always the best way to reach me. You can call me as well. It's extension 1302. But email is immediate. It comes right to me. It comes to my cell phone, and I can get back to you a whole lot faster. You will need to sign the Gefeller-Waller packet before they can return to full activity. Okay, so after they've gone through that progressive return to play, nice and easy, we ease them back into things. Before they can go, full tilt, we have to get your permission saying that, you know that this is what's happened, this is what we've done, and all those good things. Last pop quiz question for the evening. Whose responsibility is it to protect the student athlete when it comes to concussions? The answer obviously is everyone. I always like to end my concussion talk on a quote from another athletic trainer who said, "Concussions don't kill people. Mismanagement of concussions can kill people." When we put student athletes back on the field before their brain has healed and they get another concussion, that's what is killing our young people, and we don't want that to happen anymore. If you have any questions, obviously email me or call me. I'm happy to answer any questions that you have. I hope you have a great season. Obviously, go Wolves!